Okay, we still have some people logging on, but let me go ahead and get this started and bid everybody a welcome and a good afternoon. This is the second in a series of 4 live webinars that we'll be holding to share information and answer questions about what fall semester is going to look like here on Lehigh campus. Today's conversation is around community safety, health, and wellness, and we'll be joined by panelists from our Health and Wellness Center as well as from Lehigh facilities. I am Chris Halladay, the Associate Vice President for Human Resources at Lehigh University, and I'll be moderating these conversations. We generated a lot of interest last week, and we now have over 400 questions which have come in from the community, a large portion of which have to do with today's topic on health and safety and wellness here on campus. We aim to answer as many of those questions as we can in the time that we have and with the panelists that we have. You'll notice that at the bottom of your screen there's a Q&A box. We'll also be monitoring that, and as time allows, we'll be inserting those questions as they come up as much as we can. I want to note that for those of you who may have to hop off at some time and not complete this, or if you know someone who isn't able to attend today, we are recording this session, and we will post this on the coronavirus information page on the Lehigh website right after we conclude. Okay, with that, then let's go ahead and get this started. And I have the pleasure of introducing you to our new Provost and Senior Vice President for Academic Affairs, Dr. Nathan Urban. Nathan, I'm going to turn the time over to you.
Great, thanks, Chris. So, hi everyone. Thanks for being here this afternoon. Looks like we have a good crowd online here, and welcome back if you attended last week's community conversation. And if you were not able to, as Chris mentioned, that conversation was recorded and is available on the COVID website. So last week's conversation was focused really on academics and what the fall would look like from an academic perspective, what classes would be like, ways in which we're preparing to have classes online and be able to deliver high quality education, what aspects would be in person, etc. Today's focus is really on health and safety on the campus. I'm going to provide some introductory remarks about some of the things that we've been doing and looking at to try and enhance health and safety of the Lehigh campus in the COVID era. And then we'll move to questions and answers from some of our experts. As Chris mentioned, I'm relatively new here. I guess we're approaching the end of my first month here as provost. And it's been, obviously an unusual start as provost, but nonetheless, it's been really a great experience to work with some of the really dedicated people here at Lehigh, especially this group, focusing on how it is that we can make the campus safe. All of the discussions and decisions around health and safety on campus are really guided by our considerations of the best practices, the recommendations from the Pennsylvania Department of Health, from CDC, and from other leading authorities. And we are certainly looking carefully at what's happening both locally within the region and across the country with respect to increases in case counts and concerns about those increases and how it is that they affect us and affect members of the Lehigh community. I'm sure many of you will know that there has been a recent increase in the number of cases in Northampton County and in the region. And this is something that we're watching very closely. This is something that we are working in partnership with some of the local healthcare providers to make sure that we have an understanding of what it is that's happening in the community around Lehigh so that we can be responsive and do the right thing with respect to the health and safety of our family, friends and family here in the region. I will say, and I think this will probably come up multiple times today, is that a lot of the questions about health and safety really hinges on the behavior and people within the Lehigh community and in the Lehigh Valley community, sort of doing the right thing, wearing masks, abiding by sort of recommendations on social distancing, et cetera. And that is something that will be increasingly sort of apparent as we move forward into the fall. Just to give you a little bit of background as to where things stand, we have been working for some months now to try and put in place a set of protocols and plans to improve the safety of the campus. Many of the details about these protocols are available on the university's COVID website. Just as some examples of these policies and practices, we've put in place requirements for wearing of masks or other face coverings, requirements for social distancing. We've rearranged and looked at capacities of various facilities, including classrooms, to make sure that we can ensure social distancing, changing cleaning protocols, creating and installing new signage so that people to provide visual reminders of what it is that people should be doing, looking at ventilation systems within our buildings, and have safety plans that have been developed by different offices in different parts of campus to make sure that we're doing the best we can in terms of providing for the health and safety of people who will have to come to campus or will want to come to campus. We also have put in place training for everyone who is coming to campus. This training involves a description of the rules and regulations around COVID, a description of what to do under different circumstances if you have symptoms, when to come to campus and when not to come to campus. This is in place now and has been used for the last couple of months, actually, or maybe a month and a half or so, for members of the community who are coming into campus, especially around research labs. That was one of the areas that we tried to open up early on. So far, that has been a successful opening. We have had a high degree of compliance, a lot of questions, and be able to resolve a lot of questions and a lot of issues by bringing that group to campus. So I think that's been a successful aspect of this reopening. We also have plans to put in place what we're referring to as a COVID code of conduct. This is a set of descriptions of the expectations for community members when they are on campus, the things that we need to do to help keep each other safe. And I think this is, again, an important part of the message, that we have to be in this together, that my safety depends on what you do and your safety depends on what I do. So therefore, it's a real community effort. We have, in addition, been working through protocols, what to do in the cases when people will be identified as COVID positive. If somebody gets sick, what do we do? How do we respond to that? How can we help to support that person, but also make sure that we're doing things to clean facilities, trace contacts, et cetera. In particular, one of the concerns about this has been within the dorms, and so we'll talk later about our plans for isolating people who have positive COVID tests, for quarantining people, including students in dorms who are contacts of known positive cases, or people who perhaps show up at the Health and Wellness Center with symptoms that are consistent with COVID. And so we are in the process of describing these. I mean, we have protocols for these that have been worked out, and we're in the process of communicating about these protocols. In addition, we've been working through our plans for assessment and testing of COVID cases. Those of you who have the Hawkwatch app installed on your phone may have seen that there's a new daily health assessment that is available through the Hawkwatch app. This will be something that anyone coming to campus is to fill out every day. We have been working to put in place point of care testing capabilities so that if someone, a student, say, shows up at the Health and Wellness Center, we can rapidly test that individual for COVID, and so that we can then make a decision. The rapid testing should take about an hour. That will be in place so that we can then make decisions about whether to isolate that individual if they have a positive test, or whether they can perhaps go back to the dorm room, et cetera. Outside of students, we have developed a partnership with Lehigh Valley Health Network around employee health to facilitate some of these aspects of the assessment and care for people who have symptoms related to COVID. We have been working to put in place broad testing of asymptomatic individuals coming to campus. There's still some details to be worked out about that, as to exactly how that's going to be done, but that is something that we've been working hard to put in place. And that was something that really changed for us over the last weeks or maybe the last month are in terms of our thinking about that, because the previous recommendations had been that the focus should be testing individuals with symptoms, but recognizing some of the changing conditions across the country, we're now looking at how it is that we can provide testing for larger numbers of asymptomatic individuals to get a broader assessment of health across campus. One thing that I think is a very important message as part of this is that this will not be a usual semester. For no one will this be like last fall. It won't be like last fall for students, for faculty, for staff. There will be many ways in which activities and behaviors on campus will have to change. There will be sort of restricted access to some facilities on campus. There will not be large gatherings of people. Access to some facilities may be restricted both in terms of the population that can be there and also the capacity. And also the number of the hours of the day when those facilities will be available, so that we can do things like clean those facilities with greater regularity. So I think that anybody who is looking to the fall and thinking that this is going to be just like last year, I would say please, take the time to reassess that perspective, because it will be different. And I think one of the important things that we want to be able to do is to keep people safe. And that's a requirement of keeping people safe, is that we're going to have things work differently, operate differently, and people behave differently. In particular, I think student behavior is going to be very critical to the success of the semester. So students want to gather in large groups, want to have parties. This is something that is going to necessarily be restricted, because what we've seen across the country is that these large events are events where COVID spreads. And to restrict that from occurring, to prevent that from occurring, to make the semester successful, we're going to have to be very careful and not have these kinds of large scale events. And so happy to talk about those kinds of issues going forward. So with that introduction, let me turn to the expert panelists. So the three panelists today bring expertise in different aspects of health and safety across campus, and different aspects of the ways in which we have implemented new plans and procedures in order to try and have the campus be safe, and so that we can have a sustainable semester, and so that we don't have to go through what we went through last spring when campus was closed down. So the first of our panelists is Brent Stringfellow. Brent is the Associate Vice President for Facilities here at Lehigh University. Brent, you want to introduce yourself? I think you're muted, Brent.
Thank you, Nathan. As Nathan said, I'm Brent Stringfellow. I'm the Associate Vice President of Facilities here at Lehigh. And in that capacity, where I've been serving in terms of preparing our campus for the fall return is in primarily in co-chairing the task force to reopen the Lehigh campus with Chris Halladay, our host for today. What our role from a facilities point of view has been focused on really is, in obvious ways, on the infrastructure and preparing the spaces and the campus itself for the return. And this covers a wide range of areas. And as Nathan pointed out, a lot of these have been outlined on our COVID-19 website on the Lehigh page. But these cover a range in terms of increased cleaning protocols, tying in how we rearrange spaces to account for social distancing, infrastructure to promote that, looking at improvements to our HVAC systems and managing those as effectively as possible, providing signage, and then also advising the various departments and groups on campus in terms of space modifications and things they may need to ensure everybody's safety as they get back. This committee has been at work basically since, at this point, May, really starting to get these policies in place. And again, I'm talking mostly about the infrastructure. It also touches on policies for faculty, staff, and students in terms of the behavioral aspect that Nathan touched on that's still very critical, no matter what we do on the campus. In addition, we've been advised in the steps we've taken, both from the guidance from government agencies such as the CDC, the state of Pennsylvania, as well as some of our local health groups, including LVHN, Lehigh Valley Health Network, who we have a partnership with in preparing for our safe return. And then it also should be pointed out, we do a lot of work with our peers, ongoing phone calls and discussions with other universities and institutions that are grappling with many of these same issues. And that's proved to be very useful to us. So I'll be happy to address some specifics in terms of things we're doing for the infrastructure, but I will say that we've been putting a lot of work into making sure the campus is as ready as possible. Thank you, Nathan. I'll turn it back to you.
Great. Thanks, Brent. So next, I'd like to introduce David Rubenstein, who's the Executive Director of the Health and Wellness Center.
Thanks, Nathan. Hi, everyone. So my name is David Rubenstein. I'm the Executive Director for Health and Wellness, and I too am coming up on a year, actually a year ago today, starting here at the incredible, beautiful university. And it's been an incredible, remarkable year, I would say. And we, I think, hit the year in high gear last fall, and that only continued throughout the year in January and February when COVID-19 first evolved. And the Health and Wellness Center really got some, I would say, some really good experience early on in being able to work with entities across the campus in terms of putting together plans to work with students and keeping them healthy and keeping them safe and making recommendations across the university in which at every pass we were prioritizing health and wellness as really the evolution of COVID-19 continued, beginning in January and February and March, and finally in making the decisions to the university and making the decisions for the student to return. And really, I would say the emphasis, the priority has been around health and wellness and safety. And so my job as Executive Director for Health and Wellness Center is really aimed at always putting that, the health and safety of the students as the priority at every pass. And so given how the virus is spread, you can imagine that in every part of university life, in terms of whether it's academic engagement, social connection, residential living, all of which makes university life so incredibly rich, working alongside the Health and Wellness Center staff and all of the professionals across the university and thinking about the best practices in terms of mitigating risk. And of course, as the virus has continued to evolve across the world, the country, the region, and in our area as well, continuing to think thoughtfully and carefully about the best practices in terms of sustaining health and wellness on our campus. And as Executive Director for Health and Wellness, that's part of my job. So working alongside the physicians and nurses and nurse practitioners, working with all of the different officers in the Division of Student Affairs and really and facilities and across the entire university. And it's been a remarkable and very positive effort in that process in terms of it's a very team-wise effort in prioritizing health and wellness and safety. And so my job as Executive Director is essentially to keep the health and wellness and safety at a priority. And so all of those decisions, I would say this is a team that meets and talks throughout every day. And anyways, I'm very happy to be a part of this conversation, and I'm really looking forward to answering the questions and also sharing with you the many things that we are doing and have done in the Health and Wellness Center since January and February, and our plans currently, And I work really with professionals across the entire university, because it's really a team effort. And as Nathan said, you know, everybody's responsible for this. Everybody's responsible for this, and we have that in our mind. How can we create an atmosphere that helps everybody really to bring their very best in mitigating risk? So, thank you, Nathan.
Thanks, David. And then our third panelist is Sarah Stevens, who is the Medical Director for the Health and Wellness Center. Sarah, do you want to introduce yourself?
Yes, so I'm Sarah Stevens, and I've been Medical Director since January, so I also got a kind of a quick start in this, though I've been at Lehigh for 3 years. So I would really echo Nathan and David's sentiments. We've really been working at this since January, and I would say during that time, really working, you know, a big part of my job is staying on top of the CDC recommendations, the Department of Health recommendations, American College Health Association, trying to keep an eye on what's happening in the medical literature, which has been, you know, just a speed of information that I just don't remember ever experiencing in healthcare, to be honest. And at the same time, building not only university connections, but also connections with really important partners in the community. So the local health networks, working with the emergency departments, working with local health bureau, connecting with our other colleagues, as Brent alluded to, other college health directors. So we've really been working on this, and we've had kind of trial runs because we've been working on this since January. It's just that in the fall, it's going to look different. And as everybody's saying, this fall is not going to be for any campus. It's not going to be for anybody the same thing. So we really have been working to put in processes and look at our space and how we manage students' concerns to really be as safe as we possibly can. So really made a lot of changes that I think we'll bring up. So thanks for inviting us to be part of this.
Great, thanks, Sarah. I did want to, before turning it over to Chris for the Q&A, I did want to emphasize a couple of points that I think are very important. We have been working, and I think we've successfully structured the academic part of the programs at the university so that if a student is concerned, or if a parent or a family is concerned about sending their student to campus, perhaps because of some underlying health condition or because of a family living situation where someone would be potentially at risk, we are confident that students will be able to make academic progress without coming to campus. So if there is a student who wants to engage with the university completely remotely, we are very happy to work with people to make sure that they can get the education that they want and need, make progress on their degree remotely. The vast majority of classes will be accessible online. And so we want to make sure that that's in place, both for students who never show up on campus, but also because given the constraints on quarantining and testing, given the likelihood that there will be students who are sick and can't come to class, we want to make sure that students don't feel like they need to come to class in order to get the education to make progress in that class. And so that's something that we want to sort of very much assure people of. The other thing I wanted to mention is that given the critical role of the Health and Wellness Center, whatever situation a student is in, whether they're living on campus or off campus, et cetera, students will have access to the Health and Wellness Center. And that is a clear commitment. If a student has symptoms and they need to come in and get a test, we will sort of do what's necessary to get them a test. Ideally, we have in place a capacity for, as I mentioned, sort of 1 hour rapid testing so that we could then very quickly make an assessment and perhaps send a student to an isolation space where they could, be if they're COVID positive. We also would, in those cases, encourage students, if it made sense given their family situation, to go home. If that's the best place to get care, if that's the best place to be, if a student is sick, we want to sort of make sure that students have the ability and the ability to continue to make progress academically and educationally, if that's the choice that they need to make, because we want to make sure that we support students and their families making the choices that they need to be healthy. So with that, Chris, do you want to lead the Q&A?
Yeah, there's a lot of information coming out already. A lot of questions coming in too. So let's jump into this, maybe with something general. So you've talked about how this fall will not be business as usual, but education will go on. What's it going to look like? When I come onto campus, what will I see that will be different?
Maybe Brent, you want to lead that off and we can all join in?
I think there'll be some fairly obvious parts. I'd mentioned signage before, so this is one of the pieces. I mean, in terms of going into buildings, as you go through different spaces, what you'll see is signs reminding you of the expectations. So first of all, everybody will have a face covering or a mask to come onto campus. That is standard procedure and expectation for everybody. The other thing you'll notice is things like the furniture might be rearranged. There may be some, more restrictions in terms of where you may be able to go to study or how many seats might be available to study. I think we are looking at providing not just restrictions on spaces that existed previously, but you also notice we're going to be erecting some tents. So providing some outdoor space for students to study and eat in an area that is, by most current research, a lot safer in terms of gatherings and having multiple people. So we'll be providing 2 large tented areas on campus for students to make use of. So I think there'll be a lot of those things that you'll see. Some of the things you won't see, we're going to have more stringent cleaning protocols. We're going to be doing things to impact the infrastructure in terms of the air delivery systems, and those will be more in the background, but those will be changes that you'll see on campus.
Yep. And you will not see a full classroom. You'll not see a classroom with more than 50 people in it, even our largest spaces. That's something that you will not see. You'll not see large gatherings on campus. This is just, given everything we know, inconsistent with the ability to provide a safe environment to people. So those are some of the changes that will be obvious.
How about even just getting into buildings? Well, will I be able to walk into any building that I want to?
That's a good follow-up, and that will be another major change from our past. So buildings will still be accessible, but they will be locked. And this represents a change from previously at the Lehigh campus. So generally before, residence halls always have been locked and restricted to people who live there. But our academic buildings have generally been open for daytime hours. We are restricting that now. So as long as you have your Lehigh ID, and you're on campus, you would have access to the buildings. That would be, but those buildings will be locked. So we're going to be asking everybody to have their Lehigh IDs with them, students, faculty, and staff. We are going to be asking people to display them as well. And this is a twofold concern. One is obviously being sure that we know who's coming into our buildings. We have a little bit more concern in terms of some areas that might have had the public coming in and been encouraged to come in the past that we're restricting just out of safety, for safety purposes. The other is this does allow us some advantages if there is a case on campus in terms of contact tracing, understanding where students or faculty or staff have been in the course of the day, and gives us a data point to work with. So that will be implemented this fall.
Good, thank you. Another question that kind of goes along with that and has been coming up a lot is testing. So can you tell me what's going to be expected of students as far as testing? For example, will I need to show you a negative test before I get back to campus?
Currently, they're not requirement to show a negative test before coming back on campus, but what we are in the middle of doing is putting together a process for re-entry to the university. So when students, prior to students coming onto campus, were, as Nathan was talking about earlier, we are in the middle of putting together a process where there'll be testing for students who, prior to coming onto campus. So we'll want to be able to catch students who are COVID positive, and in our efforts toward, ensuring a healthy and safe campus, and then also with some follow-up testing as well. And so we're in the middle of putting those processes together. I would say the other piece that's very important is the point of care testing that we're in the middle of establishing in our Health and Wellness Center for symptomatic students. And so that process will allow us to identify within the hour a student if they're COVID positive, and then isolate as needed, and also begin a process of contact tracing and quarantining as needed. So from a testing standpoint, we are putting together a process where students that are returning to the university, there will be some reentry testing and some follow-up testing, and we'll have testing available within the Health and Wellness Center for symptomatic students.
But I won't have to test before I even come back. Is that what you're telling me?
I'm saying that the students will get a kit that they will be completing, and that test will identify students who are COVID negative and those who are COVID positive, and those who are COVID positive would not be able to come onto campus.
Okay. Very good. And what about self-screening, self-monitoring? Is there going to be any requirement around that?
Yes, so sure. So all students and staff and faculty will, on their phone, on the Hawkwatch app, have a daily self-assessment symptom screener that they complete, that they'll be required to complete, that will allow them access to campus. So that's a terrific way for, I think, students to take responsibility for their own health and wellness and welfare. And it also is a way to help keep themselves healthy and safe, and the campus as well. And it gives them good information in terms of follow-up that they need. And so there are instructions in completing that app, that self-screen, that if they do have symptoms, what their next steps are. And if it's a student, for example, it would be to contact the Health and Wellness Center. And then depending on the nature of the symptoms, we would be following up with that student appropriately. Sarah?
Yes, so I would agree that, for the people who do that symptom checker, really the goal is that if people have any risk factor, either they know that they had a contact, they've had a symptom, they just don't really feel well, it's really to make sure that they stay home, stay in their residence hall room, and call the health center, and then we will help make recommendations and make a plan for appropriate evaluation and assessment. And I think to Nathan's earlier point, we really, and Nathan and the academic team have really worked hard to offload that worry of students that I have to go to class. It doesn't matter if I'm sick. No, the norm right now is if you don't feel well, do not go to class. So I think the university is really working hard to support students in that. And then we in the health center will work with the students. It doesn't mean they're going to come that second, but we're going to make arrangements to take care of that student and do what testing is appropriate.
And you mentioned a kit that the students will get. What's going to be in that kit? Anybody?
So one of the current options for the pre-entry screening would be a self-collected saliva specimen. So they would get sent a kit, and then they essentially do like a Zoom call with somebody who kind of talks them through it, make sure it's all collected correctly, and then that gets sent back via UPS. So none of it's a charge to the student. It's a whole worked out process. But again, that process isn't all finalized, but that looks like that's going to be the mechanism that we're going to do testing prior to students returning.
Very good.
So,
And you mentioned
just if I can jump in addition, there is a different kit that sort of a welcome back kit that students are being sent, which contains at least one, I think a couple of face coverings. It contains a thermometer for daily temperature checks. There are also there's also some information sort of about the fall semester and how things will progress in that kit. And Brent, I don't know if you might have some additional details on that kit.
Yeah, and also personal sanitizer. Yeah. So basically, it's just a small safety kit to get everybody started.
Yeah.
And a couple of questions that, there's always faculty and staff, people working on campus who interact with these students. Will they be required to go through all this as well or have the same resources?
Faculty and staff coming back to campus will also have to do the daily assessment, self-assessment. We have put in place with the Lehigh Valley Health Network an occupational health and safety process that they will have access to. That process will help us with contact tracing in the case of a positive case among faculty or staff. And then that will then link to the student contact tracing operation as well. We've been sort of working with the Bethlehem Health Bureau, Lehigh Valley Health Network, and then our own on-campus resources in order to facilitate that contact tracing.
Yeah, if I could build on that a little bit too, I think, and we've had some really, we've had some practice with this during the spring semester in terms of working closely with the Bethlehem Health Bureau in terms of contact tracing and having the appropriate entities in place. So it's the Health and Wellness Center, the Bethlehem Health Bureau, different entities within the university, like the Dean of Students office, dining, the cleaning service, all of those entities working together, I would say, to ensure that everybody's doing what they need to do to develop appropriate quarantine, follow-up isolation and quarantine processes.
So you brought up a good point there, David. How are we going to ensure that people are doing what they're supposed to do? Am I going to see a lot of people wearing masks when I walk across campus?
Yeah, I would. That is the expectation that students, staff, and faculty, as Nathan was saying earlier, we're all in this completely together, and we're all responsible for each other with this. And so the expectation is that students, staff, and faculty, when they are out on campus, they are wearing those face coverings, or even in their residence hall, and they're wearing face coverings. At the end of the day, it's social distancing and face covering, and that is the most important thing that is going to mitigate risk in terms of the spread of the virus. And so we have to think about that at every pass, which is why what Brent was saying earlier, in terms of his looking at all of the different university spaces across the campus and thinking about how to ensure that that social distancing is maintained, whether you're talking about academic classrooms or whether you're talking about residence halls or whether you're talking about different parts of the campus where students like to congregate. And so it's both of those, Chris, it's both the face coverings and the social distancing. And those are two of the primary elements that we spend a lot of time with ensuring across the campus that this is really critical.
Is there something that I'm going to have to sign or agree to that I would abide by these?
Yes, both for faculty, staff, and students. And that is part of the training for everybody returning to campus. And part of that is basically an acknowledgement and agreement that you'll comply with those rules, because as David said, he said the expectation is to wear a mask. I'd go a little further. It was like a mask is absolutely required. You cannot come onto our campus without a mask. And as has been pointed out, that's absolutely essential to maintaining the safety for everybody here. I think the evidence is pretty strong at this point, and it gives us the ability to look at having some of the activities back on campus because of those tools with the masks and the social distancing.
Will there be any I'm sorry, Nathan, go ahead.
Yeah, I think I'm going to answer the question that you're about to say. You know, having these as rules or requirements is one thing. I think what's also clear to us is that there have to be consequences for when people violate them. And you know, we are certainly prepared to send people home, making sure that they leave the dorms. We're prepared to, through our student code of conduct process, to suspend students if they do not abide by the rules that they've agreed to. These are the things that are necessary for keeping campus safe. And if we identify students who are not abiding by these rules, we will not hesitate to send people home.
Okay, very good. So a lot of what we've been talking about so far has been to mitigate the risk. What's the plan that Lehigh has when someone does develop symptoms, when someone gets sick?
So one of the really good things that the university has been doing since the start of the summer is actually we have created a second health and wellness center. So another health and wellness center space in Tremblay, which is part of one of the buildings on our campus that has been renovated into another health and wellness center clinic. And that clinic is designed to see students with non-respiratory symptoms or symptoms that would not be consistent with COVID-19. So medical issues that are not consistent with COVID-19, and that helps us to mitigate risk. And it does so because in the Health and Wellness Center in Johnson Hall, which is about 25 yards away, so they're in very close proximity to each other, so the staff have a lot of access to each other. We're very close by. But Johnson Hall, the Health and Wellness Center in Johnson Hall, will be seeing and assessing and evaluating and testing students that present with respiratory symptoms and other symptoms that would be consistent with COVID-19. So when a student thinks that they have a concern, they have a symptom, they want to be seen, so one of the things that they would be doing is they'd be contacting the Health and Wellness Center, and they'll receive a triage evaluation by one of our nurses who will evaluate them over the phone. And based on those symptoms, based on the symptom picture, we'll make a determination in terms of which clinic the student should be seen, whether that's in the Health and Wellness Center in Johnson Hall or the Health and Wellness Center in Tremblay, as well as the urgency of the appointment, how soon that appointment needs to be scheduled. Is this the same hour? Is this the same day? Is this the following day? When does this appointment need to be scheduled? And where does the student need to be seen? And what are we going to be looking at? And so to mitigate risk, that's been a really terrific way to separate out right from the past students that are not well, that are ill, that are not feeling well, to ensure that we're not creating any kind of a situation where students, there's risk for exposure. Sarah?
Yeah, I would agree with that. And the other part that we've done is we've really changed a lot of our processes so that when students come for the appointment, we're working really hard. And what we've been doing actually, because we've continued to be open during the whole time Lehigh's been on remote, is we meet students at the door. Our nursing staff brings the student back to one exam room. We try to take care of everything that we need to, including doing specimen collection, nasopharyngeal swabs is what we're doing now for COVID testing. And then we do our best to help the student kind of be able to leave kind of quickly. So we've changed around that process. We don't have the point of care testing in the office right this moment. So the way it works now is we send the testing out and the student goes back to their housing. Right now over the summer, any students that are on campus pretty much right now already have pretty much isolated type housing. But if a student, say in the fall are in a housing situation where they need to be separated, they live on campus and they need to be separated, we have isolation housing set up. So they would go to that housing while they wait for the lab test. If it comes back positive, they're already in the isolation setup, and in that setting, they would be provided with meals, linen, cleaning supplies, some academic support. And the health center, once it's a positive test, even while we're waiting, we keep close tabs and close connection with the students to follow along with them.
If the student is living off campus, would they be expected to quarantine, self-isolate off campus then?
Yes, students living in off-campus housing would be responsible for isolation in their own housing if they become sick, or if they're a close contact, to quarantine there. So for instance, if 3 people share an apartment off campus and one of them becomes sick, the Bethlehem Health Bureau would be the entity that would kind of step in and help assess, and we can participate in that as well, but they help assess contacts and the timeline for somebody to be in isolation, but that would all occur in their off-campus housing. They would not be brought on campus for isolation housing.
And I would say too, the Health and Wellness Center then just continues to follow up with students. And we've had a lot of experience with this over the spring for students that we were concerned about where there was potential exposure. And the Health and Wellness then continues to follow students that have come into the Health and Wellness Center that have been tested, that are awaiting test results, and to make sure that they're doing all right, and to make sure that they have the things that they need, as Sarah was saying, whether it's food or whether it's academic support or mental health support, all of those kinds of things that are supportive for their overall health and wellness and well-being. So once a student does come through the doors of the Health and Wellness Center, or we're aware that there's testing or they're awaiting test results, is typical, we would follow up with that student through that whole process. And then of course, in that, connected with the Bethlehem Health Bureau in terms of contact tracing, as well as potentially the Lehigh the occupational health nurse that we are going to have. And it's a way just to make sure that we're covering all of the areas we really need to be covering in case this involves students, staff, faculty, and making sure that everybody's communicating with each other and everybody's getting the support really and the help that they need.
But just to clarify a couple things, I mean, there's discussion about what to do when a student is under quarantine, and separately when a student is under isolation. And just to be clear, isolation is in the case of a positive test. So we know the individual has COVID. We have isolation housing that's been identified on campus where students would go. They would, the only other people who would be there would be other students who have also had positive tests. So there would be, a separate sort of building where those individuals would be housed. Quarantine in the case of concern or suspicion, either because of, for example, because someone was a contact of someone who had a positive test. Our plan is to do that quarantining in the student's dorm building with some restrictions on use of shared sleeping rooms and also shared bathroom facilities, so that we would segregate out or separate out people who were a concern but who did not have a positive test. So there are 2 different systems in place, one for full isolation, which is a separate building, et cetera. The other is for quarantine.
Good clarification. Does Lehigh have a plan if, rather than a few infections here and there, what if there's an outbreak? What if we get a certain number that become ill? Does Lehigh have a plan to deal with that?
Yeah, so let me start off that answer. So we've been working through trying to sort of, on the one hand, make sure that we have the right information, the right data that we would need to be able to make decisions about changing the activities on campus, even to the point of a decision that we may need to send everybody home like we did in the spring. So just to be clear, this is a fluid situation. There are aspects of this over which we have control, but other aspects that we don't have control over. For example, the governor, as he did in the spring, could tell us that in-person education was something that was no longer allowed, and in which case, our decision would almost certainly be to do what we did in the spring, to go to 100% remote instruction, send as many students home as possible. That is certainly a possibility. That's something that we are, seeking to avoid through the measures that we're putting in place. But short of that, short of having to move to complete remote instruction and sending as many people home as possible, there may be situations, increases in cases on campus, increases in cases in the region, increased hospital or ICU utilization in the region, a dramatic decline in testing capacity in the region, which is something that we and many institutions are concerned about. In the event of those are things that we'll be actively monitoring over the course of the semester. And in the event that there are concerns which are raised by those, we may do things like end all in-person instruction, leave people in the dorms, but end all in-person instruction, maybe for a finite period of time, maybe for a couple of weeks, or maybe for the remainder of the semester. We have to go into this with eyes wide open about the fact that we're going to start the semester in a certain way, and we have a plan that we think will allow us to have a sustainable semester with close monitoring and sort of regulation of activities on campus. But the reality is that we need to be prepared to respond in a way to protect the health and safety of people on our campus. And so that is certainly something that is a possibility. And if that's what is necessary to ensure the health of people on our campus, we won't hesitate to do that.
And I would just add to that we have a COVID-19 response team that meets several times over the course of a week. And it's really made up of really the significant people that represent student affairs, facilities, risk management, health and wellness, provost office, communication. So it's all representatives that can quickly identify the important factors and issues that might be emerging on our campus, and to be able to make decisions, I would say, quickly, flexibly, nimbly that prioritize health and wellness. We've had some good experience with this team already, taking a look at identifying what are the important issues, indicators that we need to be looking at. And so that's another piece that I think is important.
Good, thank you. Yeah, I think that is important to know who's going to make those decisions. Monitoring some of the questions coming in right now, and there's curiosity about what we talked about with the kits. I'm not sure how many of them are referring to the testing kits as opposed to how many might be referring to the welcome back kits with the thermometers and the masks and such. But do we know how those are going to be distributed or how somebody could access those right now? Or when they would be available?
Sure. So with respect to the testing kit, I mean, this is something that has been very fluid and dynamic. We have been working with a number of different partners to identify a system for doing testing that we have confidence in. And we believe we've identified that now. And so the information about that will be available as soon as we possibly can. But until we have a little bit more clarity as to how that's going to be provided exactly and by when, that's what we can say at this point.
Okay, very good.
Yeah, I would just add there's a lot of really good energy that's been devoted towards, just like Nathan was saying, ensuring that whatever it is that we're using is really, we feel really confident in. And I think that we spent a lot of time in that process. And with something like this, you really want to get it right. And yeah, really important.
And David, you had actually brought up something earlier, and Sarah, you'd mentioned this too. Just the stress factor that we know is there because of the virus, because of change, because of things not being normal. Will we have resources for mental health for our students?
Yeah, that's a great question. Yeah, it's like really unprecedented times for everybody. It's for students, for staff, for faculty, for parents, all of us. And I think with the newness of this situation, and of course so much transition anyways, just having kids go off to to college for their first year, really any year, but certainly freshman year, you know, there are a lot of really important transitions. And I'm sure that this transition is like no other anybody has experienced, or really a transition that no one ever imagined having to experience in terms of, you know, getting ready to have their kids start their freshman year, which is it's still an exciting, incredible, and can be, you know, wonderful, wonderful time. And so to that end, our counseling and psychological services, University Counseling Center, has remained open and will continue to remain open, and has psychologists that are available for all of the students, whether they're on campus or off campus, and that will continue. They have a very, very strong program. Their services are offered 24/7. There's nothing about that that will change into the fall. They're very well aware of all of the things that are going on, and have continued really throughout the spring and throughout the summer, and will continue in the fall in terms of providing mental health services to the campus. I would also say too, on our website, there's also a COVID-19 wellness site that's devoted towards wellness resources in terms of coping through this time period, and that's a site that will continue to evolve in the fall as we really move through this time period. And I would encourage, you know, this is a really important time anyways for parents and their kids to be talking about for the upcoming fall. Anyways, this is a really, really important time to be talking about what this is going to be like. And, you know, what I would say to parents is that, you know your kids better than anybody else. And you know the areas that they thrive in, you know where they flourish, you know where their real strengths are. And perhaps, you know, in some areas where it might be more challenging for whatever reason, it might be more challenging. And so talk with your kids now about where their strengths are, where the challenges are, where the resources are on our campus at Lehigh, because we have so many resources that are student-centered and are available for students. And now's the time to really think about which resources students can, could, and should take advantage of, and have that conversation now. So when the fall rolls around, students are able to access those resources. But the time to start having that conversation certainly is now, and it's a good time. It's a good time to have that. And relatedly, I would say from a medical standpoint, from a health standpoint, is that if there are pre-existing health conditions that are concerned, now is absolutely the time to be having a conversation with your primary care physician around that health condition and risks returning to a congregate setting. Very, very important conversation to have. Now, Sarah, if you want to add to that.
Yeah, I would agree with that. It's that's very important if you have concerns about your own personal health risks, chronic conditions. You know, you should, you and your family, talk about that with your provider and think about, you know, there will be cases, I'm quite sure there will be COVID cases on campus. It is highly unlikely that there will not be. So I would go under the assumption that there will be, and that you have a high likelihood of potentially being in contact with somebody, and just kind of work through that with your provider. What does that mean for you? What will that look for you? What are your risks? How will you manage, or your family manage, if you need to be in the emergency department or if you're hospitalized? Bearing in mind that, you know, some out-of-state insurances, for instance, might not pay for local health care. So now is the time to make sure that your health insurance covers health care in this local community. And to also keep in mind that given COVID restrictions, which I think are still in place in the local hospitals, if, say, you were admitted with COVID, it's not like you're going to be able to have friends and university people come and visit you. Visitation is very restricted. So just kind of be thinking ahead about those things and how you're going to manage it.
Yeah, that's good information. That's why we let it push over the time limit here, but we're at the end. So Nathan, I'm going to hand you the mic for the last statement.
Sure. Thanks, Chris. So thanks to all the panelists for today, but also for all the work that you've done over the last weeks and months to develop these plans to have a safe campus in place for fall. I would say to everyone on the call that, especially to parents and families, one of the things that I think is very important is that if the concerns that you have are not not met, we think that it's important to be able to provide access to education on campus for students, and we're endeavoring to do that in a way that's safe. But if because of a situation, because of an underlying condition, or because of a family situation, this is something that just feels too risky to you, I would encourage you to engage remotely in education. We have done a lot to try and create that possibility and that opportunity. We are not requiring anyone to come to campus in order to continue their education. So that's something that it's got to be your choice and the choice that you and your family make. That said, we have done a lot to try and make the campus as safe as possible, to put things in place so that we can track and monitor what's happening on our campus, so that we can respond to the situation as it develops over the course of the fall. A lot has changed. A lot has changed with cases. A lot has changed with testing. A lot has changed in the environment across the country over the last weeks. We're trying to do our best to be responsive to those changes and to be in a position where we think that we're comfortable with what it is that we can offer. But it's got to be a two-way street. If that's something that you feel you would rather engage remotely and sort of do all remote classes over the course of this semester, and we will support that decision as well in terms of what it is that we're able to provide. So with that, thanks to everybody, and we'll do this again next week.
We'll do this again next week. So join us again on Thursday, August 6th, 5 p.m. The topic then will be housing and dining. We know they've got a lot of questions coming up about that we didn't have time to get to today. So we hope to see you all again then. Thank you, panelists. Thank you, Nathan. See you in a week.
Thanks, Chris.
Thank you.
Thank you.